This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh and we're in the labor and delivery department. Yeah, just behind these doors over here, little babies all over the place. It's great, and there's nothing more exciting than a newborn. Well, today we're going to talk a little bit about the difference between an OB and a midwife. You may not know much about midwifery, but today we're going to talk to Brenna Reimer about the benefits it has for all women. Well, thank you for taking some time with us today. We're talking about a midwife, and I guess just kind of give us an idea of what's the definition of a midwife these days.
So a midwife is an advanced practice nurse practitioner who has specific training in taking care of women throughout their reproductive lifespan, from puberty through menopause, and specifically in taking care of pregnant women and helping deliver their babies.
Yeah. So not a doctor, but actually a nurse, though.
Yes, absolutely. Our training is nursing focused. We start out as a RN, and then we get a master's degree in nursing and focusing on midwifery.
Okay, so what does a midwife do?
So a midwife can provide everything from basic primary care for a well woman to providing birth control, annual exams, screening things like pap smears, mammograms, and taking care of a pregnant woman throughout her pregnancy and helping deliver her baby and taking care of her afterwards.
So would a person set up appointments with you directly, or are you more like a physician assistant?
They would set up an appointment with us directly. We have our own clinic hours, we take our own patients, and the midwives here at Aurora work as a group practice. So when we have a pregnant patient, they meet all of us so that they know who's going to be with them when they go into labor and have their baby. We try and practice in a true group style so that all of our pregnant patients feel completely supported by all four of the midwives and are comfortable when they come into labor that the person who's here with them is going to be somebody that they know and trust.
Yeah, that's good, because babies don't always stay on schedule, do they?
Absolutely not. Babies come when babies want to come, and so we always want to make sure that somebody that you know is here with you when you're in labor.
And I think a perception of a midwife is that is somebody that helps deliver babies at home. Is that true, or what's the difference between somebody that would do that at home compared to somebody at say, a hospital?
That's a very good question, because there is a really big difference between a home birth midwife and a midwife who works in the hospital, such as the Aurora Midwives. A home birth midwife, there are two types of midwives in Wisconsin. There's a licensed midwife and a direct entry midwife. Licensed midwives have some formal training, and they have to pass a national certification exam. A direct entry midwife is primarily trained through an apprenticeship. Both of those midwives don't have a nursing background. They're not advanced practice nurse prescribers, so they can't prescribe medications, and they can't get privileges in a hospital. So if they needed to transfer the patient that they were taking care of at home to a hospital, they would have to transfer that care to a doctor in the hospital. A certified nurse midwife, which is what we all are here at Aurora, is an advanced practice nurse prescriber as well as a nurse midwife. So we have a very extensive formal training through a master's degree, like I was saying, and we can prescribe medications. We have privileges here at the hospital, so we can admit our own patients, take care of them while they're here, and discharge them home afterwards. So there is a really big difference in the education path for a home birth midwife as opposed to a hospital delivering midwife. Not that that makes a home birth midwife bad, it just means that that's a very different skill set and different training system for them.
Yeah. So why would a person then choose a midwife as, say, compared to a traditional doctor?
OBGYN?
Yeah.
One of the nice things about midwifery care is that midwives come from a nursing background, so we see all of the phases of a woman's life as normal physiological changes in their whole system. We look at the whole woman, not just their physical health, but their spiritual and their emotional health as well. And we try very hard to give a very holistic type of healthcare. We're very lucky. We get to spend lots of time with our patients. We get to develop really strong relationships with our patients. We get to have longer appointment times. And I think that that's one of the things that some women are searching for when they're looking for care during their pregnancies especially.
Yeah, sounds like definitely a more personal experience. And
it very much can be.
Yeah.
And that's not to say anything bad about OBGYNs,
Right.
because we have some incredibly wonderful OBGYNs here as well, and they're very supportive of the midwives and of our model of care. But if you are a normal, healthy woman and you want that sort of hands-on approach, choosing a midwife might be right for you.
Yeah. You mentioned holistic approach and, and things like that. Does that mean you don't use epidurals or any other pain medicine? Or are you pretty much on your own when it comes to pain?
Absolutely not. No, we will happily prescribe an epidural for any woman who desires one, but we're also able to be more hands-on during a labor, so if somebody doesn't want an epidural, we can help support them through that as well.
Yeah, it's an interesting approach. What is your favorite part about being a midwife?
I love my job. I think every day in clinic I learn something new and I meet a new woman and I get to listen to her life experience. But I think my favorite part is the moment when a mother sees her baby for the first time. And it's just this amazing light going on in her eyes and realizing that everything has changed. And now all of a sudden, this is what she has accomplished in this moment, and she's suddenly a mother. Whether it's her first baby or her fifth, she's suddenly a mother again.
Yeah.
So.
It sounds like a very rewarding job.
It is. It's incredible.
Yeah. Thanks for taking some time with us today.
Thank you very much.
Certainly a great option for women, and if you'd like to know more about the midwives here at Aurora, you can give Brenna or any of the other midwives a call at 303-8700. They can answer all of your questions. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Health Care.